This is Community Unity Now, the D Tycoon Show. My co-host, Bill Morton, president of the Rogers Park Chamber of Commerce, has been discharged from the Clark Manor nursing home. However, he is still not well enough to travel a lot. I am Trudy Leong, administrator of the Rogers Park Chamber of Commerce. Our very special guests today are two candidates for the congressional districts. Donna Miller for the 2nd Congressional District and Richard Boykin for the 7th Congressional District. Welcome.
Thank you.
Thank you so much.
Well, first of all, Donna and Richard, you have worked together before.
Very indirectly, but we both were on the Cook County Board of Commissioners. I'm currently on the Board of Commissioners, and Richard was a prior commissioner on the Cook County Board.
That's right.
Mm-hmm. Well, what have you learned as a commissioner that you could apply toward your seat if you win it?
Well, in Congress, I do think things that are very important are budgetary items. And I think that being on the county board has really taught me how to negotiate a budget, look for items in the budget that maybe need to be expanded, rally support around budget initiatives, and how to get things passed. And we've done a great job of that on the county board, and I'll take that experience with me to Congress.
Well, Richard, you have also worked with Dr. Willie Wilson, and you are an independent Democrat. So Dr. Wilson is more of a rightist, kind of Republican thinking, but you got his endorsement. So you're treading on the best of both worlds. How could you apply that experience and accomplishment toward reaching across the aisle so that Republicans and Democrats could work better together?
Well, you know, the Chicago Tribune said that they admire me as a free thinker, and they also admire me as somebody who's willing and able to reach across the aisle to get things done. In the House, you need 218 votes to get anything done. In the Senate, you need 60 votes for any substantive legislation. And so 9 times out of 10, you gotta get some Republicans, you gotta get some Democrats to go along. And so you put forward the best ideas. I know Dr. Wilson would consider himself more of an independent, though. And because he's supported people on both sides of the aisle. And I think you need that right now. I think it's in Washington, it's hard to get things done. And of course, people want to make sure that we lower costs, create jobs, and make sure that every neighborhood is safe. And that's what we want to do in Congress.
Well, those are really, really important goals. But as for actually achieving those goals, it's very, very difficult. By the way, since the Chicago Tribune said that you are a free thinker, any specific instance come to mind that would make them think that? What did you do as a free thinker?
I think the whole county knows what I did. I led the effort to get rid of the regressive sugar tax. I mean, it was a tax on Gatorade, orange juice, apple juice, diet sodas, and so we led the effort to get rid of that. But it took bringing people together in order to do it. Paid a political price for it. We also got rid of the tax on feminine hygiene products that I was proud of. But I follow my district, and I will do that. I will always put people above politics and make sure that the people are served. And I think more folks need to do that at every level of government. And if we do it, then we can get things done for the people. Right now, year after year, people are paying more for health care. They're paying more for groceries. They're paying more for rents. And year after year, communities are being scarred by violence, gun violence in particular, throughout the 7th District, homicides, smash and grab robberies, assaults. We got to bring all that stuff down, and so I'm excited to do it.
Yeah.
Actually, I think Bill and I also were working toward the candle tax as well, getting rid of the sugar tax. We probably worked together at some point or other because we had a big coalition
Absolutely. There's a lot of people working to get rid of that. And look, it takes a lot of people to work together, and that's what you have to do and build coalitions. And we were proud to work with you all and didn't even know you at the time.
Right. Well, Donna, you mentioned the budgets, and currently, of course, the administration does not really pay heed to the judicial branch nor the legislative branch. So, how could you overcome that when you try to make sure that the budget is a good budget and if the budget is followed?
Well, absolutely. So I'll just say, too, I was endorsed by the Chicago Tribune, and my endorsement was also talking about being moderate and bringing people together and being able to have those kind of conversations. Not only did I learn that from being on the county board, but also in my prior professional career. I'm in corporate America. I worked in nonprofit as well. And people want to talk to people they can talk to. And that's what is missing, I believe, right now in Congress. And what we're going to see in this next election is Congress is going to change. And we're going to have the House. And I look forward to that and being in Congress where we're taking over the House and making sure that we are electing the Speaker of the House and Hakeem Jeffries and making sure that he is the person who's going to lead the Democratic Party for these concessions that need to be made so we can actually get things done. People are frustrated because they don't see us working together, but they also don't see us working at all. They feel like nothing is happening. And we don't want to be the kind of people who go to work to do nothing. We want to accomplish something. So how are we going to bring people together? I think it starts by having conversations, building coalitions. And so on day one, once I get there, we will have new people in the House, not only from the state of Illinois, but across the country. We need to come together, have a meeting, talk to each other on both sides, and say, what are our goals to accomplish something? Healthcare is a big goal of mine. We've cut healthcare. $880 billion have been cut from healthcare. That's hurting people every single day. And that's what I hear mostly from my constituents on how are they going to make it. And so when we can provide that answer for people, how are you going to make it? You're going to make it because we're going to bring not only that funding back, but we're going to expand. I believe in expanding preventative care and making sure that people have access to health care across every area. Almost every area in the 2nd Congressional District is a healthcare desert. We cannot get well, we cannot have preventative care if we have no healthcare providers and no hospitals and no clinics in our district. So one of the things we have to do is how are we going to put that back in people's area that they want to, and how can we make sure that people have health care? And that's one of the big things. We have to build those coalitions and that starts by having conversations. And by that time, everybody is going to see the effects of how healthcare is cut and how it's affected them. And they're going to be sick of it. And so they're going to want people to fix it.
Well, right now people are sick of it,
Yes.
and they do have legislators in Congress. So why are congressional people not doing what you say that you want to do now? Why what's keeping them back from doing what their constituents need? And if there are some forces that are preventing them from doing what they need to do to help their constituents, how can you overcome those forces?
Well, it's coming from the top. I don't think that Congress itself are the ones blocking the ability to expand health care. It's coming from the top. So when we have...
And what do you mean by the top?
Our president, and who's making just sweeping changes without even negotiating, without even going to Congress, without even bringing the bill to Congress to say, how can we put things in here that both sides can agree on? Those conversations aren't happening.
But how could they happen if he's still in office and then you are elected into the seat?
Well, like I said, the House is going to change. So how it's going to happen is that the House will have more authority because the House will have majority.
Okay. Okay. Well, Richard, you mentioned that you want to hold the education department accountable for what they need to do. How could you do that?
Well, look, I think my colleague said it best, that we're going to be in charge. That gives us the ability to set the agenda, to set what bills come to the floor. It also gives us the investigative authority to be able to hold the administration accountable, to bring them before us and hold hearings and hold people accountable, including ICE, including the Department of Justice and others for the illegal activities that are taking place. I mean, all of those people who've committed crimes against the country, the Constitution, can still be prosecuted. And so we're excited about it. And so on day one, we're going to begin by reversing the cuts to Medicare, Medicaid, and SNAP. We're going to also reverse the cuts to the Department of Education and make sure that people are getting that funding from Washington, here in Illinois, and other states as well. Right now, we have one of the largest achievement gaps, especially among black and brown children here in the state of Illinois. We got to make sure that our kids are learning how to read, write, do math at grade level. And it begins with resources. It also begins with the parents, of course. But we want to give them all the resources and tools that they need to make that happen.
Well, there have been a lot of Democratic administrations, and then still the kids are not able to get the education that they need. So how could you overcome that? Because even when the Democrats were in control, the state of education is still not up to par. How could you make sure that this time around it could be different?
Well, look, you use your prestige as a congressperson. Use your voice. You advocate. You make sure that people are being held accountable for educating our children. Look, I'm one of the few people in my district, in my race, I'm the only person who said that the state should opt into the federal tax scholarship program. That's a program that can bring $1 billion to the state of Illinois.
And why aren't we in that now?
Well, because the governor and the legislature have to decide if they want to opt in. This is under the one big beautiful bill, or the ugly lousy bill, as most people call it, that was passed. But this provision will give Illinois $1 billion. It gives public school students money, it gives private school students money, and basically it gives them money for tutoring, books, transportation. All of these things will help close the achievement gap. I think that education is the great equalizer, it's the ladder to success, and we have to make sure that we have an educated citizenry. If our kids aren't educated, then you're going to see violence go up, crime go up. And so I want to make sure that our kids are educated. I want to make sure that students have an opportunity to either get a trade while they're in school or go to college. I mean, it's just that simple. We got to have an educated society.
Well, I just kind of see that it's very, very difficult because I admire Congressman Danny Davis, whom you worked with for how many years? 8 years, 10 years?
10 years.
10 years. So he actually gave me a scholarship when I was at Wright College, so I appreciate that very much. But still, the state of education has, despite all his efforts to improve education, it is very difficult. Is just more money enough to bring us up? Because it seems as if there's more to it than that.
Look, I think it's a combination of things. I think it's standards. I mean, the Illinois State Board of Education lowered the standards in reading and math so that they could make it seem like more kids were passing the test. I mean, but it's a combination of things. You got to work together. Parents got to be involved and at the table. But you got to have the resources too. There are some schools that are under-resourced and underserved communities. And so you got to make sure that they have the resources. They got to have access to tutoring, access to after-school programs, and things like that. Sure, are we where we want to be? Absolutely not. But do we have to work to get there? Yes, we do. And we got to get there in a hurry. I have a sense of urgency regarding education, regarding health care, regarding public safety, and regarding making sure that everybody has a job opportunity if they want it.
Donna, you mentioned that healthcare, of course, is very important to you, and it should be. So how is it that healthcare is still not where it is as some places, other places in the world that's not in our country? It's much better. What's holding the U.S. back?
Well, we need to implement programs like the ones I've done as a county commissioner. we have a maternal health crisis right now in this country, which we shouldn't have. We shouldn't have that at all.
And is it like more among women of color?
Yes, absolutely. African American women and women of color are 3 times more likely to die in childbirth. And this is a conversation that we have not had. We haven't had enough. So actually, one of the things that I'm very proud of that I did on the county board was I had hearings over the last several years focusing on maternal morbidity and how we can improve the outcomes. I was able to start the first ever doula program at Cook County Health and Hospital System. So doulas are mid-level providers that help at any stage of the pregnancy. This could be a national program. And this is what we need to look at. And the things I've done, things I've championed are really things that are duplicatable. I want to take that with me to Congress, although there's pieces of it there now. We need elements of it to be continued and expanded across the entire country so that all women can have access to high quality health care, but so that women are not dying as a result of having a child at any stage of their pregnancy.
So when the separation between the haves and have-nots, is it on account of the cost of healthcare? What exactly is it in healthcare that is preventing African American women from getting the maternal care that they need?
Well, in this specific instance, the studies have shown that African American women have the less maternal morbidity. It's not based off education, it's based off of access, and it's also just based off of pure and simple not listening. And that is what's happening in our community. People aren't listening to women. We just had a story, I think everybody probably knows the story that happened in my district, in the 2nd Congressional District, where a woman went to the hospital to have a child, she thought she was in labor. They sent her home. Then she ended up having the baby in the car with her husband. So doctors, healthcare providers are not listening to women. They're not taking it seriously. So that is not necessarily access.
Are they listening to white women more?
Yes. Mm-hmm. The studies have shown that, yes. And so that's what needs to be improved. That definitely needs to be improved. But we also need healthcare providers who are trained to listen, trained to understand what's going on with African American women and women of color all across the board. But we also need to make sure that we have more access to healthcare providers in our communities. Like I mentioned earlier, we have healthcare deserts all across the 2nd Congressional District, probably across the 7th District as well. And why is that? Because also there aren't enough providers. We need to have more jobs for nurses.
Is it that the providers feel that in those places it's not that profitable, and then they're not opening their healthcare centers over there in the marginalized districts?
It could be, but also there aren't clinics. We have federally qualified healthcare clinics in certain areas, but there's just not enough. So we have hospitals, but there's just not enough. We don't have enough providers because there's not enough providers, period. So yes, we do need to have a viable workforce trained to come into these communities.
Well, that's perfect. If a lot of the people in your district need the jobs, then it'll be perfect so that they could access those jobs.
Absolutely.
Is there anything that's preventing them from accessing those jobs?
Well, training, and then we're just talking about lack of education. We don't have enough people who are going to schools where they can get the education that they need so they can go into these careers.
How could we connect the dots so that the education is there and the training is there so that the jobs are there, and then unmarginalize these marginalized districts?
Well, I think the commissioner makes a good point, because here in the 7th, we actually have more hospitals and healthcare resources than any other congressional district in the country. We have 21 hospitals in our district. We have a boatload of federally qualified community health centers. Miles Square is just right here. And we also have, the medical district and all of that. But just a mile or so away from here, we have the largest life expectancy gap in the country in West Garfield Park. There's a 20-year life expectancy
And what
gap.
is causing that?
Well, let me say this. So people who live in West Garfield live to get to be about 67. People who live downtown in Streeterville, just 7 stops on the Green Line, they live to get to be about 87. What's causing it is a combination of things. Lack of access to quality and affordable health care is where it begins. And then, of course, you got the environmental pollution. You got lead service lines in the homes. The lead is leaching into the water. you got gun violence, you got mental health issues, you got a myriad of issues that are causing it. People can't get housing, and so their health is diminished as a result of that, their mental health. I mean, so you got to employ all of these wraparound services and the social determinants of health to make sure that people are healthy. Look, if a person's not healthy, they can't hold down a job. If they're not healthy, they can't study in school. And so health should be a constitutional right in this country.
Well, that's a lot of social infrastructure for you to accomplish in a term of a Congress. So, how would you start?
How would I start? I'm going to let my colleague go first because she's ready.
No, well, that's okay. I'm sure we would start the same way. First, we need to start by putting back the cuts that were already implemented. So we have to get back that $880 billion. We need to expand it. That's my focus. Put it back. And it can be put back when we have the right people there. We need people who understand science and data back in the top parts of our country.
However, we do need to analyze this because even before the cuts, the problem was there. The problems were there. So evidently, the money that was cut is not enough to lift these communities. What has to happen?
Focus. Go ahead.
What I would do is, look, we're going to cut the defense budget by 10%. That's going to give you over $800 billion that can go into health care, that can go into shoring up Social Security and some of the other safety net programs. But we're going to focus like a laser on lowering costs. On day one, what I'm going to do is I'm going to take back our tariff authority from this president. The president has raised prices on the American people by these unconstitutional tariffs, and he still continues to do it. We're going to also reverse the cuts to Medicaid, Medicare, and SNAP. That's going to give us more people who have access to health care. We're also going to pass the Affordable Care Act subsidies that will allow people to get health care coverage because the premiums right now are too high. We're going to do those things, and then we're going to create more jobs. We have to bring more jobs back. Here on the West Side, we've lost hundreds of thousands of jobs that have not been replaced. We used to have Sears and Roebuck Company right down the street, 10,000 jobs. Zenith, Aldean's, Western Electric, International Harvester, Brock's Candy Company. You name it, all those jobs have gone. We don't have anything. And that's why you have destabilized communities throughout the 7th District. So we got to deal with that, and we got to bring safety to these neighborhoods. People aren't safe in certain communities. We got to make sure that they're safe.
You mentioned that you want to cut the military by 10%.
Yes.
Have you researched about how, do you have enough votes? Because a lot of, you do know that people have to get elected and then they take campaign contributions, and sometimes those contributions prevent them from voting the way that they might vote otherwise. So how would you be able to accomplish that, do you think, to reduce the military budget by 10%?
You got to persuade people. I think my colleague said it best. You got to talk to people. You got to put forward your ideas. The thing is that when the stars align, you got a great idea, you get 218 votes for it, or you get a veto-proof voting block for it, or you get 60 votes in the Senate for it. But sometimes it takes a little bit longer, but you have to continue to try. If you don't put forward the ideas, you'll never get to where you need to be. And if you don't dream big, you'll never get anything accomplished.
You sound like a very impressive presence and hopefully a very good persuader. Is there anybody in Congress now that has been able to accomplish some of what you have said, that is such a good persuader as well?
Well, I would say, obviously, my colleague knows from Congressman Davis, and I would say Congresswoman Kelly, whose seat that I would be looking towards, she had to corral people around healthcare. And that's one of the things that we have in common as far as that goes, and focused on how we can have, she created the Healthcare Brain Trust, which is across the entire country. So we have to persuade people on what we need. First of all, we have to understand what the problem is. Then we have to understand what to do to fix the problem. And then we get our colleagues to join in and focus on how to fix it. So that's where we're at right now. I know it doesn't seem like it's been working as efficiently as possible, but that's probably because we need to own the House. And once that happens, we'll be able to make sure that we'll get some of these things done.
If our viewers want to learn more about you, Richard Boykin, where should they go?
RichardBoykinForCongress.com. RichardBoykinForCongress.com.
I spell everything.
RichardBoykin for FOR Congress. CONGRESS.com. COM.
And you, Donna Miller, if our viewers want to learn more about you, where should they go?
Well, thank you. It's just Donna for Congress, DONNA for FOR Congress.com. And I look forward to that opportunity. It's great to speak with you.
Well, thank you, Richard Boykin, who is running for the 7th Congressional District. And also thank you, Donna Miller, who is running for the 2nd Congressional District, for joining us on Community Unity Now, the D-Tycoon Show. From Bill Morton and me, Trudy Leong, we thank you so much for watching, and we will see you again next week.